Hello everyone. Now that you have sat your MRCOG Part 2, which a lot of you would have done the exam in January, and are probably also eagerly waiting for results, which I hear are next week. I wish you all the best, and I thought I'll start giving you an update about MRCOG Part 3 exam so that you can start collecting the resources, start booking onto the courses that you may require in order to be able to pass this exam successfully. So the next dates for the MRCOG Part 3 exam is 8th to 9th of May, 13th and 14th of May 2024, 6th and 7th of November 2024, 11th and 12th of November 2024. Now, once you get your MRCOG Part 2 results next week, fingers crossed, you will then start thinking about doing your part 3, and the sooner you do your exam after your part 2 the better, because a lot of the information that you will need to pass the part 3 is the stuff that you've revised for your part 2 already. So it's advisable that you try and sit the exam as soon as you've passed your part 2, and delaying it is not going to benefit you in any way, form and shape. The best news about the MRCOG Part 3 is you'll be relieved to know it doesn't take as long to prepare as the Part 2, and it's not the same kind of material that they're trying to test in the Part 3. The Part 3 is a very practical exam, so you've done lots of practice and you're working every day on the wards, you'll have no problems in passing this exam, but it does require preparation and revision, so don't underestimate that bit, because to every exam there's a certain technique to pass it, and with the same with the part 3. So by doing some extra revision and some extra courses, you will make sure you're on the right track. Right, so the exam is going to have 14 tasks in a circuit. You will be tested on 5 domains, which include patient safety, communication with patients and their relatives, communication with colleagues, information gathering, applied clinical knowledge. Each task is 12 minutes long, which includes 2 minutes of reading time. So the way it works is you'll be given a task sheet, so you'll be sat outside the room, and you will be given handed out a little task sheet. You'll read the question on the task sheet, and you'll have 2 minutes to prepare and gather your thoughts. Now, if it's a question about, say, find out more about this patient's illness and she's got menorrhagia, then you want to think about the causes of menorrhagia, what kind of questions you may want to ask the patient, what kind of treatments you want to discuss with her, how it's impacting her life. So you want to kind of start gathering your thoughts as to how you're going to approach the question. Now then the task will start, which you'll get 10 minutes for. Within those 10 minutes you will be able to complete the task, finish it off, and then there'll be normally there's a buzzer that rings to inform you that the time is over and you need to move on to the next station. Right, so how are you going to prepare is there is 2 different tasks that you will be asked. It'll either be a simulated patient-colleague task, or it'll be a structured discussion task. Now what that means is you'll either have to speak to the patient directly in your task or to a colleague, or you will be asked questions by the examiner. So you need to prepare for both sorts of scenario, and you will be what you need to do is be prepared, not try and predict what the station might be, because I think that's the biggest mistake candidates do, is try and start to work out what the next station may be. That's completely the wrong approach to it. You have to go into the exam with a completely open mind. Whatever question is given in front of you, you want to concentrate and try and answer it, and use all your energy to try and get to making sure you get maximum marks for that station. You don't want to think what the next one could be, what the last one was, how the last one went. all those things you just need to completely ignore, and just focus on the task in front of you. Right, so now the good news for this exam, as I said, is that you can prepare for this exam in a few weeks, in about 3 weeks. Well, at least that's what I did to prepare for my exam. It's quite an exam that can be tackled quite easily, quite fairly, quite quickly, because it doesn't involve going through the heaps of material that you've already gone through for your part two. So what you now have to do is just focused revision for a few weeks. If you are in the UK, you'll have no problems in doing the exam preparation in a few weeks. If you're outside the UK, however, then it does mean that you will need to revise your guidelines properly again, because you may not be very familiar with the UK practice, which means that you probably need to spend a little bit longer to prepare for the exam, which may account to a couple of months instead of weeks. So you've got plenty of time to revise the material and then to practice it, because practice is key for this exam. Now, where are you going to find the material? Now, obviously, there is part 3 revision books. There is guidelines, which again would be your green top, your nice guidelines, and your part 2 revision notes. If you already got your part 2 revision notes, don't throw them away, because you will need it again for this exam as well. Right, so for my part 3 exam, these are the 3 books that I used to revise effectively for it. Now, in my opinion, if you have these 3 books, or you can get hold of them, then you don't really need any other books to revise for this exam. So make a note for these books. Now, these books go through different scenarios. It's got plenty of revision material in terms of what kind of questions can be asked, what kind of scenarios can be questioned on in terms of interaction with colleagues, with patients, structured discussions, and also timing wise, for example, it's got a very elaborate mark scheme, so you know exactly where you need to be focusing on in terms of answering your question. So they're quite good, and as I said, I think if you revise just from this book, then you are going to be absolutely fine for the exam. Now, when I did my exam, I revised with 3 other colleagues, and we were a small group of 4 people, and all of us passed the exam. And this is the same technique that all of us used in order to sit the exam and pass it. So we all used the same book, we went to the same courses, we spent equal amount of time in terms of revision in the evenings, and we all worked in the UK, and it meant that we all passed the exam without any difficulty. So you should have no problems either. Now, this exam, however, does require you to book onto a revision course. Now, that you can be very open in terms of choosing what course you'd like to do, but you do have to book onto a course. Now, I did the RCOG one on the main RCOG website. There's a part 3 revision course. I did that one, and I found that was useful for me, and that helped me. There's lots of other courses that are run as well, and I've generally heard quite positive feedback for those courses. Now, I help you prepare as well for the part 3 exam. So if you wanted, you could book with me onto a course where we'll go through some practice stations. I will spend time with you in order to tackle every station, so you'll be doing it in real time, but I'll be giving you feedback as we go along. We'll be talking about some tips and tricks, and if we realize that actually you have certain weaknesses for the exam, then you can book onto my further help sessions as well. But it's not very expensive compared to all the courses out there. It's compared to if you compare the cost of the courses outside to what I'm offering, it's actually half the price. And the reason being is I really want to work with you. I'm not interested so much in the financial aspect of it. I'm more interested in making sure that you pass this exam, because I know the difficulty that I had to go through in order to pass these exams successfully. So if I could give something back to you guys, and I would really love to, and if that means in terms of a revision course or revision day, we will go through 10 stations, and what you have to do is just practice those stations in real time with me. I'll be the examiner, I'll be the assessor, and I'll be the patient for you as well. So you just go through it with me during a live call, and what we then do is reflect on the feedback and decide if we need any further help going forwards. And as I said, the actual cost of this is only half of what is out there. So please do consider. It helps me to carry on the work I do, but equally it also gives me the feeling of giving back to you guys in order to help pass the exam. There is no better feeling for me that gives me greater satisfaction than having one of you contact me to say, look, I'm interested in your course, I'd really like to go forwards. Here's how I book onto it, and then you guys updating me with your results to say, look, I've passed. There's absolutely nothing that beats that feeling. Right, so the next thing that you need to do for your MRCOG Part 3, which I've also emphasized a lot in Part 2, but this is very crucial for Part 3, because Part 3 is a practical exam. You have to practice what you were saying. You don't want to be repetitive. You want to be able to explain things effectively to the patient in simple language, not in medical terminology. And for you to be able to do that effectively, you have to practice. So you have to get yourselves into small groups of at least 3 people and take turns in terms of, one could be the assessor, one is the patient, one is the candidate, so that one person is observing the other two and their interaction, and is able to comment on the 5 domains that we were talking about earlier. But that way you'll be able to all take turns and give feedback to each other. And if you just practiced about 3 scenarios on an evening, and you did that maybe about sort of 5 to 6 times before the exam, you would have enough practice to be able to sit the exam successfully. Now, one of the questions I get asked is, how much revision do I need to do? Which means go through the guidelines and TOG articles. Now, that question is quite an important one, actually. Now, in my exam and in the exams of my colleagues, I remember they had asked us totally full guidelines on a topic, like, for example, PMS or something. Like, it was the entire guideline, like what does it mean, and what's the causes, and how can it be treated, and what are the symptoms. And literally, if you'd read that guideline, you'll have no problems passing that station. So those sort of topics, I feel like you do need to be able to revise that guideline effectively, so that you can retain the information and then be able to answer those questions in the exam. So you do need to have good revision of the guidelines that you've already revised for your Part 2, because that's where you need to be focusing on. Not so much the TOG articles, but it's mainly the green top guidelines that have previously come, are likely to come, and did come for my exam itself. So I can only talk from experience, and this is experience I have gathered over the years of not only mentoring you, but also having sat the exam myself. So I would really emphasize that you do your green top guidelines really well, and that's where you need to be focusing on in terms of the revision material for your Part 3. But then some of the things you'll come across when you're practicing the stations. So for example, there's a station on shoulder dystocia, then you will be able to recall how much you really remember. And if you don't remember anything, then you'll be able to go back on it and revise. So that's somewhere you could focus as you go along. But I think if you've got green top guidelines, a summary, then that should be enough. Now, again, green top guideline summary is something that I offer, something that I have made over the years by actually going through every single guideline word by word. Now, this is something I also have offered, and I will be putting a link underneath this video for you. So if you were interested to buy a copy for yourself, then just let me know, and I can sort that for you. Good luck in revising for your part 3. If you are interested in any help from myself, then please let me know. Don't forget to subscribe to the channel and like the video, and comment if there is any suggestions that you have. Thank you so much for listening.